is Dr. James, and today our topic is entitled Men's PSA Worries and Women's Hormone Changes Explained. That is the topic here. You see, when we are looking at two topics at the same time, the PSA that men worry about, when the PSA rises a bit, when they go for test, they panic. They feel that the conclusion is cancer. No, cancer is rare in the prostate. There are reasons why the PSA may go high. And then I'm going to tell you that the women hormonal changes or the shift in estrogen and progesterone can affect a woman's mood or energy, skin and hair, and sexual drive. You see, if you look at a man will say, what is PSA? It's prostate specific antigen. It's a protein produced by even healthy prostate, because this protein liquefies semen for fertility. So prostate, the PSA is so important for men's fertility. But of course, what could cause the rise or temporary rise when you go for a check? A man, listen to this carefully. Before you go for PSA test, the following should be considered, because it can increase PSA test results. So number one, when you have sex or you ejaculate, you should have to wait for 7 days before you go for PSA test, because during ejaculation your prostate will contract and release PSA into your blood. It could be in your blood for about 3 days. So wait for 1 week before going for the test. Number two, anal stimulation or prostate stimulation. You should have to wait. If there's any kind of stimulation around your prostate or anal, you have to wait for a week before going for PSA test, because that can influence the results. Heavy exercise or cycling, you have to rest for at least a week before going for the test. Digital rectal exam, it's called DRE. A doctor may put the hand there in the anus to check if your man prostate is alive. That can cause irritation to the prostate. So after this exam, wait for at least 1 week before going for the test. The next factor that can influence is recent biopsy or surgery. Can also influence it. You have to wait for at least 2 months before going for any test. Catheter that they put in the urethra of a man can directly influence PSA results. Prostate or urinary infection can immediately also produce high PSA. So you have to wait and recover and wait for 6 weeks before going in for that. Urinary retention or holding urine for a long time can also irritate the prostate to release PSA in your blood. So don't hold urine and don't retain also urine in your blood, in your bladder. Okay, so you have to relax actually 7 days before going for that. Long sitting or biking pressure. When you sit on the bike, it can irritate your prostate. So sitting for long because of job or driver, relax after every 1 hour, and then relax about 7 days before going for PSA test. Natural aging naturally enlarges the prostate, so the prostate could be leaky. So mild rise in PSA is normal for men. The doctor should only monitor it from time to time to see if there's no sharp rise. Daily PSA variations, slight day-to-day changes are normal, and repeat tests is necessary. So a man should have about 2 or 3 PSA tests before coming to conclusion, not to jump into biopsy, because biopsy has its own damaging effect. It can cause what they call intraprostatic adhesion, where the man may have scars inside the prostate for even 2 years and will cause unnecessary problems. Women, hormonal changes will definitely cause hot flashes, night sweat, vaginal dryness, discomfort, especially during sexual intercourse, mood swings, anxiety, and of course irritability. A woman can easily get angry because of hormonal changes, trouble sleeping, and fatigue, and changes in skin and hair and weight, especially the weight in the mid region. It's all hormonal changes. So a woman can naturally balance the hormones, and a man can also take care of their prostate and not to avoid unnecessary problems. As you listen to me, if you have any problem as a woman, hormonal changes, there's a natural way. Don't go for any synthetic estrogen, because that can cause increase the risk of uterine cancers, breast cancers, and of course stroke and blood clots. A man, we have natural way to preserve your prostate at a high age, so you don't have any problem. If you have any chronic problem apart from what I've said, reach me on this number, +44738 464 7300. Go to my YouTube channel to support it and be alerted as well. Go there, put in Dr. James Natural Link. Dr. James Natural Link. Thanks a lot for joining me today, and thank you for listening.